Welcome everyone to another wonderful episode here at Doctors of Podiatry. I'm all gowned up. Caesar, thank you for being here with us today once again. So today I'd like to present this case, a relatively young patient. Presented to our office not happy with the appearance of both feet, specifically more so the second toes. Historically speaking, we do see our practice, aside from what everyone sees on our channel, we focus our efforts on primarily cosmetic and functional, minimally invasive foot surgery. What exactly does that mean for all the people out there? If you guys want to have a better idea of the type of work that we do, Instagram, we have tons of great before and after pictures. A lot of great content, Jaws Podiatry, Instagram. So without further ado, let's take a look. So as everyone can see here, this is the Morton's toe, long second toe. I've always been a firm believer that there's a time and a place, and the patient is 65 years old or 65 years young. And the patient finally this time the patient did not know that these these procedures did exist. The toe shortening of the second toe, primarily in this case. Sometimes it's 2 and 3, sometimes it's 2, 3, and 4. In this case, only number 2. As everyone can imagine, not only is this a functional problem, that the toe is long, it's been uncomfortable for many years. Same thing here, but also the aesthetic element, right? Hiding both feet for so many years. In addition, hammer toe correction, removal of some unsightly corns, left and right. We're gonna nip and tuck the foot a little bit here and there, and really beautify both feet. That's the goal here. Dr. Wagner, wow, toe shortening is a thing. Yes, we focus our efforts in helping people. Not only helping people here, but also helping people here feel better about themselves. So, this is a great video for a lot of great reasons. Not only are we going to be correcting the functional structural problem, but also up here, and you can't put a price on that. So we'll go ahead and put a pause on this, and then we'll finish the video at the end. Okay? Stand by.
A few inches later.
We're all done. Beautiful transformation. And that's kind of like the beauty of this type of surgery. Office-based surgical suite, patient is awake, local anesthesia, patient walks in, walks out. No pins, screws, or plates. What you guys are gonna see are the very delicate, intricate splinting and bandaging techniques that we will go ahead and implement for the course of the next 4 weeks or so. Okay, you will see a little bit of blood. That is totally normal. So without further ado, let's take a look at here at the left foot first. So as everyone can see, a very robust and dramatic transformation. Second toe has been shortened quite a bit, to say the least. The sutures here, this is where we excised the unsightly corns. Those are not very pretty. We are rotating now. Everyone can see that the toe is actually straight. Now we can see not only the nail that is on the top. Before, it was actually curling underneath the fourth toe. It's what we call a little shrimp. So we have de-shrimped the toe, if that makes any sense. So we're gonna go ahead and again, we're rotating the toe, and that's gonna be, we have recreated that rainbow effect, right? That parabola. In respect to the right, same thing, right? Stab here a second. Same thing, okay? Unsightly corn, there's an unsightly corn there, and we straightened this toe, and then we rotated that one as well. So this is, again, beautiful. We were able to shorten these toes quite a bit. And a lot of people are always asking, Dr. Wagner, what's the maximum amount of shortening? And every patient is different, right? What we don't want to do is compromise the function or structural integrity of the digits. Very, very important. So number one, do no harm. That's what we always keep in mind, and be able to achieve that final clinical outcome. Caesar, anything else that a lot of people ask, maybe?
No, how did it go for you?
It went great. It was very easy. It wasn't painful at all, and it was fast. And I loved the results.
Super. One of the things that we were talking about before we underwent this transformation is the social and the psychosocial elements, right? A lot of people are not happy with the appearance of their feet. They're simply not. My thought process is, if there is something that we can do to help an individual feel better about themselves, then why not? If done correctly. Okay, that's very, very important. So we want to make sure that we don't compromise biomechanics, structural integrity. Very, very important. So, this is only the beginning. Like any type of elective surgery, there is a recovery period. But what we're going to go ahead and do today as well is we're going to apply a very long-acting local anesthetic to make sure that we can put those toes to sleep for a couple of days or minimize the discomfort.
Thank you, Dr. Wagner.
Welcome.
Thank you so much.
You're very welcome. Okay, so we will continue to do what we do. Again, a lot of people, Caesar's going to upload this into our YouTube platform. But the truth is, a lot of people see, a lot of other things that we do. This is a little bit kind of different. We do have a very robust surgical practice. And, a lot of people will, Dr. Wagner, why don't you show the videos, right? Why don't you show, how you accomplish these things? People are always wondering. And that's sort of like where the magic really happens. Proprietary. Caesar told me to say that. So if you guys get mad at Caesar. Not me. As always, we will continue to do what we do to continue to educate the world that these techniques do exist. These not only minimally invasive, but aesthetic, cosmetic techniques do also exist. As always, thank you for watching.